Hi, I'm Dr. Rupert Suckling. I'm the Director of Public Health here in Doncaster. Doncaster has now been placed in the very high Tier 3 of the government's new coronavirus risk alert levels. This means that Doncaster has been placed in the highest category because our rate of infections are rising rapidly and doubling almost every week. Our current rate is well over 250 per 100,000 people and is heading towards 300. All age groups are being infected by the infection rate rise, so the virus is clearly circulating within our communities and is spreading, not halting. So people in Doncaster have now got to follow stricter guidance, such as no household mixing, either indoors or outdoors, so keep to your own household or support bubble. The rule of 6 applies outdoors in parks and public gardens, and pubs and bars must now close unless they operate as a restaurant within the guidelines. And there are more guidelines available on the council's website. This rise in infections will inevitably mean that more people are being admitted into hospital, and at Doncaster Royal Infirmary, NHS staff are seeing more and more people being admitted to hospital, some needing intensive support, including ventilation. We should also expect more people to be tested positive and to continue to recover at home. If you do have symptoms, it's important that you self-isolate and organise to get tested. Of course, this is worrying news for Doncaster, and like other parts of South Yorkshire, we have all got to help to bring the infection numbers down. Each of us and all our 300,000 plus residents has a responsibility to help, and I'd urge us all to make the right choice and help us bring the rate down together. Please follow the new guidance and help the NHS cope with the extra demands that they're seeing. I am monitoring the situation on a daily basis and I will update you on how we're doing, so please do your bit for Doncaster. Thank you.
Hello, I am Richard Parker, Chief Executive of Doncaster and Bassetlaw Teaching Hospitals and registered nurse. Over the past 2 weeks, our hospitals have seen the number of COVID-19 positive patients increase sharply, and in my 38 years in the NHS, I have never known a year like this one, and I know my colleagues are feeling the same way. In the past week, the number of patients on our wards have doubled, and if this rate continues, we will have more patients in hospital in the next fortnight than at any point during the first wave of the pandemic. Moving into a state of very high alert means that we may be able to slow down the current transmission rate, enabling us to deliver safe, vital care and treatments for our patients through the next wave and winter. We all appreciate that everyone is finding the situation very challenging, but I strongly believe that adhering to the enhanced measures is currently the best way to protect our communities. We are also coming to a point in the year when flu and norovirus begin to circulate. Even if you have never had it before, please make it a priority to get the flu jab this year. COVID-19 can affect everybody, so please keep yourselves and your loved ones safe, and remember hands, face and space. Thank you for continuing to support your local hospitals and healthcare workers, and together we will again flatten the curve and save lives. Thank you.
I'm Dr. David Crichton, local GP and Chair of Doncaster Clinical Commissioning Group. Local primary care services continue to be open and have been throughout the coronavirus pandemic. I'd like to take this opportunity to thank all of our staff for their ongoing hard work in incredibly challenging times. Doncaster practices, along with others across the country, have had to adapt the way they work. They've done a fantastic job to introduce new processes and embrace digital technology to ensure they continue to provide safe care. Some of these changes may be very different from what people have experienced in the past. More people are now able to access medical advice in the comfort of their own homes and whilst at work. However, if you do need a face-to-face appointment because your medical condition requires it, then you will be offered one. We understand that phone lines are busier than usual and you may have to wait longer to get through to your practice. Many patients have now switched to use online services as an alternative. Care navigators, the call takers, are trained to help you to get to the service that can best meet your needs. Remember, there are a wide range of health services available to us in Doncaster. NHS 111 is available for support both online and via telephone 24 hours a day. As winter approaches, we see more minor illnesses, and you can often speak to your local chemist or pharmacist who can provide some advice and treatment. We have the same day health centre, which is open every day of the year, and we also have our GP out of hours service. At the moment, we also have a mobile health bus which is making its way around Doncaster and will continue to do that till the end of March, and anyone registered in Doncaster can make use of this. Details of all of these services are available on the CCG website and via social media channels. Please only go to accident emergency at the hospital if you have a true emergency. Thank you.
I'm Sarah Head and I'm a nurse here in Doncaster. I'm the lead nurse for primary care quality. We are extremely proud of the hard work our primary care staff are doing to keep you well this winter and during the coronavirus pandemic. But we need your help to keep this up. When you're out and about, it's absolutely vital that you follow the latest guidance. It's there to protect you, those around you and your NHS staff. If people don't follow this guidance, it could really impact on the care and services that we can provide. Should the virus get into a practice, it could increase the number of staff that would have to self-isolate and ultimately could mean that some practice services would not be available. So in Doncaster, it's so important that we do this together and that we all follow the guidance and that we could come out of this a bit quicker. If not, we could be in these restrictions for a very long time. Winter is also a time when other viruses lurk about, so I'd really like to take this opportunity to say to anybody who's eligible for a free flu vaccination to please go and organise that now. It's probably one of the best things that you could do to protect yourself and others around you during the winter. Finally, I'd like to say a huge thank you to everybody who use our services appropriately and for all the kindness and compassion that you've shown our NHS staff over the last few months. And I am really proud of the healthcare system that we have here in Doncaster. I'd like to wish everybody a healthy winter and ask you all to keep following the latest coronavirus guidance to help protect our community. Thank you.
My name is Dr. Nav Aluwalia. I'm the Medical Director of the Rotherham, Doncaster and South Humber NHS Foundation Trust. As we enter what must be an anxiety-provoking time for many of you, because we're going into Tier 3, which is the very highest level of COVID restriction, I'd like to say that if you look after yourselves, if you look after your families, not only can you make sure that our communities are safe, you're going to be able to protect my brothers and sisters behind me who work in the NHS. If they're kept healthy, they can make sure they look after our vulnerable patients. And those patients could just be members of your family. So please, follow the rules, do the right thing, keep yourselves healthy, your families healthy. It worked last time, we did it together, we can do it again. Thanks again.